Thank you so much. So at the outset, I would like to thank Dr. Prashant sir, he is not here right now, for giving me the opportunity to talk about two things that are very close to my heart, the Leadership Development Program by AIOS and the Young Ophthalmologist Society of India. So I think we have established through the debates in this session that leadership, though there are born leaders, but leadership can be learned. These are a set of skills that can be acquired. During our ophthalmic teaching, during our MBBS and school, hardly there are any books and any pages that talk about leadership as such. But I feel even for a young ophthalmologist, there are various spheres of life in the early practice where they deal with leadership, maybe leading themselves into learning new stuff, managing the hospital in some way or the other, and at times some small roles in the society leadership as well. So when I saw this notification by Dr. Partha Viswas, who was the then chairman of ARC in 2017, so I was very fascinated by the program and the outline that it gave, and there were so many things that we had never been exposed to. So this is the first session that we had, an open house like this one. There were sessions by the Arvind Eye Care System where they talked about hospital management and great words of wisdoms by mentors of LDP. Then which was followed up by a mini MBA at V School in Wellinka. And it had some great topics, again, which we had never, formally been exposed to, like the various leadership models, management strategies, and, finances and all these things. And Natarajan sir also got us to, learn a few steps of some exotic form of dance. And then it was followed by the LDP program at the Pegasus, which was the icing on the cake. And, we really did a lot of activities on team bonding, which were there. And then it was concluded by the concluding session in the subsequent AIOC. So most of the activities that were there for the LDP were concluded by almost the September, October of 2018. And that was almost the time then we took over as the next office bearers of the Young Ophthalmologist Society of India. And if you see that most of our, office bearers and executive members are LDP graduates. We have the, current members also who are part of this program, Dr. Nupur, just a second, okay. So then all of us sat together, most of us were LDP graduates, and then we, thought about the things that we needed to work on. We wanted to develop platforms for young ophthalmologists. We wanted to generate content that is relevant to them and work on issues, find out the issues that they are facing and escalate them to the concerned authorities. So coming to generating platforms, the first was the AIOC forum, and we are very thankful to AIOS for giving us this opportunity of having our sort of annual meeting. This was an international meeting that we did in collaboration with the Singapore Society of Ophthalmology. It is a tradition that we continue every year. During COVID, we made this session truly international with almost more than 20 countries participating in that session. Then we thought, managing things by meetings at the national level will not do the work for us. And then we reached out to the various state bodies, state societies to help us in this. And they were very kind in, giving us sessions in almost all of their sessions, all of their annual meetings. And almost all the state societies were very generous, and they gave us this opportunity. So these are glimpses from all these meetings. Now coming to the national bodies, our biggest support system is through AIOS, and in 2019 we got the YO Lounge. That was a dedicated space for the young ophthalmologists, and our team built up a great program which we do every year. Sessions like Meet the Mentors program, where we invite leaders and program directors from the biggest institutes in India and get them to interact with young ophthalmologists one-on-one. We did the YOSI hackathon, where we brought in 3D printers and ophthalmologists and biomedical engineers to work on some very interesting projects. This is the ARC YOSI quiz that we did that year. Similarly, all the subspecialty bodies have again been very generous and have given us sessions in given time in their already a very compact program, but they have always been very generous with that. So we every year hold a AIOS writing competition to just keep that creative spirit going. Coming to our efforts on the international level, we are very aggressive with these efforts. We are very ambitious, and in 2020 we became the first and till date the only young ophthalmologist body to be accepted by ICO as its member. Following that, ICO gives us the opportunity to take care of all the young ophthalmologist sessions that are happening in WOC. We are involved with the Asia Pacific Academy of Ophthalmology as well. I am on the standing committee of the YO group, and we have developed really great ties with all these colleagues from the Asia Pacific. Last year, we started the Rising Star program where we select the top young ophthalmologists from the Asia Pacific and do a session similar to LDP with them. Now, I am on the editorial board of the YO newsletter as well. This is something similar to the YO Times that we bring out. And all the other leading YO groups like the American Academy, all our colleagues from across the world, we keep interacting with them on a very regular basis. Now, taking the young ophthalmologist movement forward, we are trying to help other countries as well in their attempts to come up with their young ophthalmologist group. We have helped South Africa, our Moroccan counterparts. We are deeply involved with the activities of the Bangladesh young ophthalmologist group, the Taiwanese counterparts. We helped South Koreans to establish their young ophthalmologist group. We helped Jordan. Now we are working with Nepal, Pakistan, and Japan in these subsequent months to come up with their YO groups. In 2020, just before COVID, we organized the first global YO summit in collaboration with the Singapore Society of Ophthalmology. And we just concluded last month the second global YO summit. And hopefully next year we'll be bringing that to India as well. So with these increased activity at the international level, we have seen a growing participation from our young ophthalmologists in these meetings. And almost all the awards are being bagged by our Indian colleagues, and it is giving them an exposure to international training opportunities as well. So coming to the content, we have a regular publication that is the Young Ophthalmologist Times. It has been appreciated all across the globe, and it's a very useful source for training and young ophthalmologist related articles. We have a YouTube channel which is very popular. We have something called as YOSI Flash Notes. We do recurrent meetings, the late night retina, surfing the anterior segment. We have a regular journal club that is happening, and we have a very dedicated legal cell which helps young ophthalmologists with their legal issues. And we have a very active socio-cultural team led by Dr. Nupur, which looks things at the lighter side of it. Coming to the issues that the young ophthalmologists face, we do regular surveys to identify these issues. We have a help desk where young ophthalmologists can reach out with their issues, and we have a dedicated job portal. We identified that fresh candidates have a lot of trouble finding a good job, so this is the portal for them. Now we are getting stronger both at the national and the international level with over 4,000 Indian and international members. But LDP has not just helped us with YOSI. Almost 1.5 years back, I started this Swarn Jyoti Eye Hospital, and over the past 1.5 years, we have established 5 branches and seen almost more than 25,000 patients in this 1.5 years. So all the learnings from the leadership development program helped me there as well. And our mentors from LDP, Dr. Prashant, Bhavankule, Kasturi ma'am, they've all been there to support me in this journey. So I'll just play a very embarrassing clip, which is from my introduction way back in 2018 to the LDP, at the LDP. Can I have the sound here, please?
Netralaya, I'm working as a fellow in the Vitro-Retina Services. And I would like to thank AIOS and all the mentors here for this opportunity. And I've just come here to grow, and I don't consider myself as a leader, but maybe I can grow and help others grow on the way. So,
you think that you do not make a leader?
I mean, as of now, I'm not a leader. I'm just too small for that. But
Tell
I
me,
just want to grow.
Who is leading your life?
Of course, sir, I'm leading my life.
You are the leader
Yes.
already.
Yes. That's true.
Read
Thank
the
you.
book Magic of Thinking Big. Thinking small is crime.
Yes.
That's what David Sharp says. You want to achieve you want to reach the moon, you'll reach.
Next.
Thanks.
So don't think small of yourself.
So that was the first lesson at LDP. I have not forgotten those words till yet. And there were so many lessons that we learned across the whole journey. So, no, I have not lost weight after LDP. I've definitely gained weight after LDP, but it has been a life-changing experience for me. I do not claim that it will be a life-changing experience for you as well, but if you want to change your life, it will definitely help you. You will find mentors for life, and you will find friends for life as well.